I'm going to back up a little bit and explain that I do idiomotor responses slightly differently to the way it's very often taught. It's very often taught that you get the first finger of the dominant hand for yes, and then the first finger of the non-dominant hand for no, which technically I think is fundamentally mistaken. I'll explain why. We all know, because of strokes, that the left hand is being controlled by the right hemisphere and vice versa. And therefore, if you have answers coming from different hands, you've got answers coming from different hemispheres. If you go to Anglo-American, they used to have remaindered a book by a guy called Fred Schiffer called Of Two Minds. And Fred Schiffer was a Harvard psychoanalyst and psychiatrist who became fascinated with patients who'd had commissurotomies, where the corpus callosum had been severed, the connecting fibres between the two hemispheres, had been severed in an operation usually to stop the spread of epileptic seizures. And there are lots and lots of interesting case stories about people that have had these commissurotomies where, because the two hemispheres aren't talking to each other in the usual way anymore, an individual who is apparently normal will go to the wardrobe and take out a red tie to dress with, and then the other hand will take it away and put it back and take out a blue tie, because the two hemispheres don't agree. Or the alarm clock will go off and one hand will reach over and put it on snooze, and the other hand will slap them around the face and tell me to get them to wake up, because the two hemispheres don't agree. Now, you effectively have two slightly different, in fact quite radically different, brains here that communicate with each other. But they can hold different opinions. And the danger, I think, of having yes, no, is that you're only finding out yeses from this side and no's from this side. And it's very easy to avoid. It's really easy to avoid. Instead of saying, use the index finger of your dominant hand for yes, and when you're ready, move it, I say to people, I say, I want your subconscious mind, only your subconscious mind, I don't want your conscious mind doing anything, don't do anything deliberately at all, it's fine if nothing happens. Just your subconscious mind to take control of a finger or thumb from either hand to use as the signal for yes. And then once you've got whatever it might be, from whichever hand it might be, now take a different finger or thumb from the same hand to use for no. And actually, usually, in my experience, usually, you get them in the left hand. And my explanation, the simplest explanation for that, I think, is, generally speaking again, the left hemisphere is most closely connected with conscious activity, with detail and the present and all of that, and the right hemisphere is most closely related, not uniquely and not exclusively, but most closely related to unconscious mind, non-conscious mind, subconscious mind, the past and the future. So no surprise to me that mostly idiomotor responses from the unconscious mind appear in the left hand. If you're systematically asking for yes to come in the right hand, you're almost inviting social compliance, or at least there is an increased propensity for that. So you don't need to take the risk. My strong recommendation is be non-directive for the first idiomotor response, and then get the second one from the same hand.